Let's just start out. I've just got a number of questions that I wanted to maybe rocket fire and just have a brainstorm session about. The first one is I'm going to frame this message that I think really thoughtful healthcare providers are migrating into functional medicine. And I think part of that is driven by the fact that they aren't getting the results that they want in chronic disease when it's exclusively conventional or pharmaceutical based. And so that natural tendency has leaned into finding supplements that are part of the naturopathic world as a way to broaden the scope. And if we're not careful, functional medicine looks like a supplement business, if you will. It looks like, okay, we're going to keep doing some of these pharmaceuticals. Now we're going to add these supplements, and that's functional medicine. Do you have a strong opinion one way or another about that?
Well, I think you make a really good point. I think that the challenge that we have as practitioners is that it's very difficult for people to change what they're doing with their life, their health, their diet, their lifestyle. And I find that oftentimes when I'm working with people, if they've been sick for a long time, it does require some significant amount of supplementation initially to kind of get them going and doing, getting them on that path. However, I think the major challenge is that taking things off over time is not always something that's done in the community in the alternative community, let's call it. I mean, I think functional medicine has, good ideas in the sense of looking for root causes of illness and disease, but I think it sometimes is slightly more focused on that rather than focused on how can you optimize your health. And I think if the focus is more on health optimization, then I think that it's easier for people to realize that it's not always about supplements. It's really about trying to create a foundational health perspective in people. And if you can work on that, then oftentimes, if you do need supplements, you can take them off very quickly because people are starting to do the things that are allowing them to get off supplements over time. And, I do think that it's a challenge overall because people just kind of go and find like the newest supplement, the best supplement, and going for like the shiny little things. But like, I've done this talk before where I ask people in the lecture hall, usually practitioners, and sometimes just lay people as well, like how many people in this room are taking supplements, and then 95% of people will raise their hand, and then I ask, well, how many people have actually measured what you need and are taking supplements that reflect those needs? And 5 years ago, 5% of people would raise their hands, and 3 years ago, 25% will raise their hands. And maybe now about 50% of people. This is practitioners included, right? Because often what you'll do is that, you might measure a couple things that you need, but then you're just taking other things that you think that might be good for you. And that's where we get into trouble, I think. And a lot of the alternative world is that you're not just giving the foundational stuff, but you're giving, maybe way more than we actually need to, especially when you're just trying to work on the basic stuff is what I really work on in my practice is basic stuff first, make sure you have energy metabolism working well, making sure your detoxification systems are working well. And then what can support those are the most important things when I think about it.
Oh, that's awesome. Thanks for sharing that. Would you say sometimes supplements help manage symptoms while people are working on their foundation?
For
sure. What are the foundational things to you? Where do you always default and say, hey, look, at the end of the day, these foundational things are essential. What are your top?
As far as supplements goes?
No, as far as lifestyle goes.
Lifestyle, yeah. So lifestyle means it's the basic things that everybody really knows and has a hard time doing, which is getting enough sleep, for example. If you're not sleeping well, your immune system is going to be shot. You're not going to make good energy. You're not going to detox well. You're going to be yelling at your kids and your wife and, your grandparents or whatever else. So sleep is a big one, obviously. Probably a number one thing for most people because it's free. You can, you don't pay any money when you sleep most of the time. Making sure that you have, relatively good, good in quotes, diet as far as relatively clean. And there's lots of different options here depending on the person and their goals. But overall, it just means no processed foods, and not eating every single hour of the day. If I can start off with that with most people, they usually will do better. So everybody's got their own ethical beliefs regarding, vegan diets and carnivore diets and everything in between. I tend to be more leaning on the non-vegan side because I find it's very difficult for most people to stay healthy that way. There are exceptions to that rule. And I know there's a lot of, people have ethical considerations and things, but diet's a big one. And it can start out very simply for people. The other thing is, and as I said, this is that you can just not eat too. Intermittent fasting is an interesting thing that you can try. And it may be something that can help you regulate your blood sugar, regulate your mood, help with cravings and all those kinds of things. So, and then movement's very important. That some sort of, strength exercise weekly, several times a week. And then also, I find that walking is hugely helpful for my patients overall. So just walking, if you can get walking in 30 to 45 minutes a day with your mouth closed, actually, and nasal breathing, it's huge. I have a friend, his name is Brian McKenzie. He does a lot of breath work. And I was talking to him about this, and it made a lot of sense. From a nasal breathing perspective, you get more nitric oxide produced that way when you nasal breathe as opposed to mouth breathing. And I also find, and there's good studies on this, like people that walk more burn more fat in general. So you will actually see your waistline go down over a couple of weeks at most, if you're just walking 30 to 45 minutes a day. So, I mean,
Yeah.
those are some of the major things that I think about. Of course, there's more, but so sleep, food, exercise, and then and the other one would just be relationships and making sure that you have a good community around you. You're creating one as best you can. People that feel isolated will die sooner in general. So you can be very happy being alone. I mean, like, a lot of meditation teachers will teach you, alone but never lonely kind of deal, because you always have something interesting that you can observe in your own consciousness. But in general, those are like the four things that I tell most of my patients. Then there's sunlight too, but I think that's another. But anyway.
Yeah, I was going to ask you, when I first asked you that question, you said, of supplements. So let me circle back to that. If you were to say, if I said, hey, Scott, what are the top 5 supplements? What's your Fab 5? What would those top 5 be? I know that's a dumb question, actually, because it depends on what we're talking about, but there are groups of supplements that are just super healthy and super good for people. So I'm curious, where are your top 5?
Well, I think I could take it in 2 different ways. Like you said, I think one way I'll take it is that there are usual types of deficiencies and toxicities that I will see with people when I'm seeing them in clinical practice. What I would say there is, like, when I'm thinking about, so I use what's called metabolomic testing on my patients. And this is through a process and through a framework called Health Optimization Medicine in Practice. This is a nonprofit organization that trains practitioners on how to optimize health. There's a 7-module certification course. The first module is on metabolomics, which is basically the study of what's called your metabolism, what's happening real time in your cells. And so I kind of have a good sense of what most people are going to need before I do the testing, but I do the testing to know for sure. But usually people are, in some case, almost all cases, need some sort of B vitamin support, some sort of basic antioxidant support. And typically they'll also need vitamin D, for example, like almost everybody, and some sort of probiotic. Like, that's what I'll give almost everybody, just as, like, if I don't know what their basic foundational status is, although I would like to check to see exactly what they need if they were going to, go through my process and take the testing and go that way. But when it comes to things like sort of outside of, like, quote unquote, the basic stuff that I would be looking at supplementing in almost everybody, which I do just at various levels, depending on what they need, depending on testing. I have a couple of things that I feel like everybody benefits from. And usually these things relate to if they're more of an on person or an off person, but most people in life are are on too much. They're just on all the time. They're always busy. They're always overscheduled, and like they're always feeling like they have a little brain fog, fatigue. They have those kinds of things. And then I think of how supporting the energy system and also supporting the GABA system. The GABA neurotransmitter system helps calm things down. And so from an energy system perspective, like kind of like your on switch and helping you be more on, the one I think about all the time is methylene blue, because it's a fantastic support to the mitochondria, and it's supportive in the sense that it doesn't cause a lot of stress on the system at low doses. It just increases energy production and also increases antioxidant capacity. So it's going to give you more of a subtle rise and give you more energy throughout the day. You can take it in combinations, as we do have in my company, which sometimes I'll recommend depending on the person. But in general, methylene blue is a really great one. And then when I think about what I can do on the off switch, I think about how can people kind of calm down. Often people will use various things like alcohol, for example, at the end of their day to relax, but we know that alcohol trashes your sleep. And so oftentimes what I will think of is something that can relax them without trashing their sleep. And so I like things that are in the GABAergic side and the endocannabinoid side as well. So things like kava and CBD and CBG. And for sleep, there's other ones as well that can be very good for relaxation and sleep induction, and then maintenance as well. So I kind of work on the GABA system on the off switch a lot for people, because I find that most people are in this world going too hard, too fast, especially Americans. So I try to emphasize recovery. From anybody from my elite athletes to my moms and new dads and things like that, and everybody in between. So those are 2 kind of categories, I would say. And then it's like, then, like everything else, like it has to be sort of individualized a little bit. You can use various other things for sleep, other things for anxiety. You can use other things for energy as well, depending on what they need.
I want to ask a couple of follow-up questions amid that. When you do
Yeah.
metabolomic testing and we're
Yeah.
looking, and you said, everyone needs a little bit of antioxidant. Is it safe to assume that the antioxidant that you referencing is using methylene blue, or are you also using other forms of CoQ10 or glutathione or other antioxidants in that mix?
That's a good question. So we talk about in metabolomics, we use bioidenticals, which means that these are the things that your body has been seeing throughout all of evolution. So it would not be things like methylene blue, which is not something that the body has seen until recent years. It'd be something like, for example, when you talk about an antioxidant, it'd be something like N-acetylcysteine or NAC, which is the building blocks of glutathione in the body. You'd be using vitamin C, vitamin E, vitamin A, vitamin K, depending on what you think that they would need. Oftentimes what I'll do for people that are just getting started is I'll give them all the fat solubles together, like vitamin D, A, D, E, and K together, for example, as one thing. Now you do have to be careful because giving antioxidants is not a panacea at all, because antioxidants also in too much of a quantity, especially ones like CoQ10 and vitamin E, can actually be oxidative, which actually can cause the opposite effect in the body if you're taking too much of them over time. So, and then you don't want to downregulate your body's own production of these things too. So that's why I'll often want to be testing these things ahead of time. But almost everybody that I've seen over the years has some sort of antioxidant deficiency. So usually I'll start off that for a short period of time until we get into testing back.
When you're doing testing with antioxidants, what is the marker that you're typically using and then basing your judgment against in terms of dosing or frequency and so forth?
Yeah, there's a number of things you have to look at. The thing about metabolomics is that it's very, very comprehensive, and you have to be looking at various aspects of the testing to kind of cross-reference to see what you need. And that's why you need to be, that's why you need to learn how to do it. A lot of the testing companies will give you like a calculated readout of but that's not usually a great thing to go by, because it can be helpful, but you have to look, you're talking to somebody individually, like right now, and you get a clinical understanding of where they are. And then if you're a practitioner and you've been doing this as long as you and I have, it's like you kind of have a good sense of people in about 5 minutes at most about what you kind of think that they're going to be at and where you need to go. Although you're surprised sometimes, but in general, I'm usually thinking about what we need to do foundationally and how we can help them. But I'm usually thinking about it in that context.
Okay. I've often used, I want to get your response to this, because sometimes I've not found other practitioners that have done this a lot, a couple, but I've explained to patients when they have a massive inflammatory response, it's not uncommon in conventional medicine to give someone like a Medrol dose pack, or you give them prednisone at 40 or 60 milligrams for 1 week. And the intent of that is I'm going to give you a massive anti-inflammatory, then high dose for a short duration, because we just want to hit this and knock it down. And we all know that the evils associated with prednisone, if you did that in a diabetic, their A1C, their blood sugar is going to go crazy. Oftentimes there's steroid psychosis and people don't sleep very well. They get agitated. That's common. I have done the exact same things with supplements. I'll take a liposomal glutathione and say, hey, I'm going to treat you like I would treat you with a Medrol dose pack or with prednisone, but I want you to use this glutathione liposomal 5 cc's 4 times a day, or 20 cc's a day if you just can only take it one time. And let's do that for 1 week and see what happens. And usually, like you can predict the people where oxidative stress is overwhelming because they have autoimmunity. I mean, you could just look at someone's medication register and predict that with high degrees of accuracy. And then they do a glutathione challenge for 1 week. And to me, it's uncanny how many people have come back and said, dude, I can't believe the difference. To me, it's often as effective as prednisone without the evil side effects. Complexity then lies in how much do they continue taking.
What do you do next?
After that fact. Yeah. So anyway, respond to that. What are your thoughts about that?
Well, some people are just so deficient in various types of antioxidants, glutathione being our primary and our master antioxidant. And so if you have a lot of stress on the system, what that often means is that you have a lot of what's called oxidative stress. Like there's a lot of inflammation related to oxidative stress. And so if you can neutralize that oxidative stress with something like glutathione, especially acutely, you can see that. And I've seen it over the years in a number of different patients, especially people that have more chronic neurodegenerative things like Parkinson's and Alzheimer's, and actually do very well with IV glutathione for this reason, because their brains are so deficient in it overall. So I think it can be very diagnostic in multiple ways. And so there's so many diagnostic things that we do, even just with interventions like that. You can do an intervention like try this for a couple of days and see how you feel, and then diagnostic one way or the other. So one example I give is that most people don't do well with GABA supplements. GABA itself is a very large molecule that gets across the blood-brain barrier very poorly, usually. So that's why when you take a GABA supplement, it usually has like at least 500 milligrams, but usually like 4 to 5 grams is what people have to get an actual effect. However, if you do get a significant effect at lower doses, it's almost diagnostic in most cases that you have a leaky brain, that your blood-brain barrier isn't working as well as it should. And so I've had a number of clinicians talk to me about this over the years, since our company has a number of products that work through different mechanisms to increase GABA and to have other molecules in the actual products or compounds in the products to get over the blood-brain barrier and work that are not GABA itself for this reason. But another diagnostic criteria. So if I give somebody a GABA supplement and they're like, "Oh, this feels great," I'm like, "Oh, well, we have more work to do." But usually if it's a leaky brain, it usually means a leaky gut. So that's where you're going to focus most of your energy. Anyway, so.
If I remember right, Trocalm that Transcriptions offers has a GABA, but the unique thing about that GABA, it's at molecular weight's much smaller than a typical GABA molecule. So the thought is that it's easier absorbed and maybe we'll get past the blood-brain barrier even if there isn't a permeability issue. Am I remembering correctly from reading?
You're close, yeah. So it has a vitamin B3 attached to the GABA molecule, and the vitamin B3, we call it nicotinyl GABA. And as a result of the B3 getting is attached to it, it gets easily across the blood-brain barrier because vitamin B3 leads the way, and then GABA follows. And
so it's
then
kind of a carrier.
It's a carrier, yes. And then what's cool about it is that in the brain, vitamin B3 and GABA hydrolyze, so they separate. And then you have increased vitamin B3, which is mildly activating. And then you have the GABA itself, which actually binds the GABA site, the GABA receptor at the GABA site. And so what's nice about that is that people can take Trocalm and they can feel less anxious, but they also don't feel tired because they get a mild activation or a mild sort of steady state, which is difficult for people to reconcile a little bit when they first start taking it, because most people that take anxiety drugs or anxiety supplements will feel that deadening, that sedation kind of feeling. Yeah. And so, for example, when I take CBD by itself, that's kind of how I feel. I feel like a little bit, I'm calmer, but I'm also like duller, I'm a little bit deader. Yeah. But if I can take Trocalm during the day and I'm good because it's got this mild amount of vitamin B3 that's going in along with the GABA, and it's got a little bit of kava as well, which binds to the GABA receptor at a separate site called an allosteric site, and has CBD and CBG, which are working on modulating the endocannabinoid system, but also work on GABA too and regulate GABA production. So, and most people have had this experience where like they're in the middle of their day and they're having a really stressful moment and they forget they were supposed to do, or they forget their words, or if they're on a podcast, they forget they want to talk about because their brain is so stressed, like so hyperstimulated, and blood flow actually decreases to the frontal part of your brain where your executive function is, where you'll be able to retrieve memories and all those kinds of things. And so if you can just take the edge down just a little bit with something like Trocalm, it can really help calm down the nervous system and let you function better too.
Yeah, this is one of the things that is a benefit, because oftentimes I've used progesterone in both men and women as a kind of a GABA analog, and it'll help induce that calm and that sleepiness. But the disadvantage of progesterone is sedation, right? And so
it makes you sleepy.
There's a number of women that will, and I have a handful of men, mostly men who have had head injuries where sleep's a problem, that they'll just have that hangover. I don't like to call it a hangover. That's a bad statement, but there's just a little bit of leftover first thing in the morning from that progesterone. So it's nice that the Trocalm and GABA may not do that. So that's cool.
It's more of a short acting one. We do have a longer acting sleep formula that does have some longer acting GABA in there, especially a compound called agarin, which is from the Amanita muscaria mushroom. psychedelic mushroom, but we don't have, it's not psychedelic, this particular compound. The other compound in the mushroom is called ibotenic acid, and that's neurotoxic and causes psychedelic experiences. But the agarine actually binds to the GABA receptor site on the GABA, so the GABA site on the GABA receptor. And so it's long acting. It lasts about 6.5 hours for a half-life. So it can make people, some people that are sensitive to GABA will feel groggy in the morning when they wake up. But oftentimes GABA is one of the reasons why we can't maintain sleep, especially during our REM cycles when we have the flying or getting chased by bears and things like that, where our fight or flight system get turned on slightly because we're having this real feeling of having a dream of that craziness. But the GABA keeps us regulated along with 5-HTP as well.
I want to go back and ask another question where you talked about a lot of people, to try to calm at night, they'll use a little bit of alcohol, which trashes their sleep and so forth. I totally agree. Most of my neurological patients, I always say, hey, look, I don't endorse moderation in all things. I think that's actually a bogus statement. I think alcohol is neurotoxic. It is in low doses. It's a disaster in high doses. And sometimes I feel like I butt up against the medical community, who generally says, oh, a little bit of moderation in all things. And I'm like, no, I'm definitive on that. And sometimes I wonder, okay, is it too much? Am I overwhelming? Do you have a strong opinion about that? Is that something where you float somewhere in the middle? You're not as aggressive as I am at telling people, hey, let's really get off alcohol. Let me help sort through that. Where are you at in that spectrum of moderation in all things?
Yeah, I'm with you especially when it comes to brain injury, Randy. I mean, like, people that have had a neurologic insult should not be doing anything that's going to damage their brain. And, I think a lot of this has to do with doctors wanting to drink. Doctors wanting to do doctors wanting to do certain things, and they want to do everything in moderation. So that's what they tell their patients. But I completely disagree with that. I think it's misguided for a lot of different reasons, a lot of different things that doctors will say, or even like the guidelines that we have out there that tell us that we can have processed food 5 times a week. Like, no, that's bullshit. You should not be eating processed food. It is not ever good for you. And nor is alcohol, unfortunately. I mean, there's a spectrum here. I do think that in some countries around the world, it's done in a very intentional way, with dinners and with community and with relationships. And I think that could be very healing and healthy for some people. But overall, the way the American culture is, alcohol is not integrated in any that way in capacity. And so definitely people that do have neurologic injuries, I say absolutely not at all. And then if people want to have it from time to time, I always try to make sure that they're going to drink. They're just try to drink and finish drinking at least 3 to 4 hours before you go to bed. Make sure you're well hydrated. And I have my clients with all these protocols to help them if they do decide to do that. But I just ask them all the time, is it really worth it for you to take these 10 supplements if you're going to go drink, or whatever? And then sometimes they say yes. And I'm like, okay, fine, go ahead and do it. Right.
I like your statement. It's if I'm not a shamer and I'm not judging them. If they want to use a little alcohol, they can. I just am trying to say, hey, listen, in the spectrum of what we're trying to work through, that's not going to help you reach your goals. So to your point, you take 10 supplements, you finish with a strong nightcap every night, probably isn't going to help you reach your goals. So just be aware of that.
Yeah, 100%.
Okay, another question that I had is, I began following you a while back, specifically about hyperbaric medicine, because you're board certified in hyperbarics. Would you share a couple of clinical scenarios wherein you think hyperbaric shines and should absolutely take the lead in treatment because of its benefit in these given scenarios?
This is a good question. So the way I think about hyperbaric therapy is that you have kind of 2 buckets. You have like your acute injury, where you have a lot of acute inflammation, acute trauma, acute infection. Then you have more of your chronic issues, where that things have been going on a long time, and like your chronic fatigue syndrome or your long COVID or things that have been happening for a long time. So where hyperbaric therapy truly shines is if it's used intentionally in either direction, but especially in the acute side. The more acute the issue, the easier it is to see significant benefit very, very quickly in a hyperbaric chamber. I mean, to give an example, they're doing a phase 3 trial now, but there's a phase 2 trial done on patients with severe traumatic brain injuries, severe enough to be sedated, to have part of their skull taken out, and have drains in because of pressure, and intubated. Okay, and they did just 3 hyperbaric sessions. The first 3 days they reached the ICU, and their mortality rate was cut by half just by doing that different intervention. Everything else was the same as they would typically do somebody post severe brain injury. So that's significant. And you can see that across the board in people with acute infections that are sensitive to high oxygen, meaning that they're like low oxygen bugs that do not do well in high oxygen environments, like flesh-eating bacteria is a very common one, necrotizing fasciitis. You can see it also in people with acute injuries, like acute traumatic injuries. Like you can see if, and there's been studies on acute heart attacks, acute strokes, acute traumatic brain injuries, as mentioned, spinal cord injuries, heart attacks,
Even just
amputations.
post-surgical, someone
That's
has
where I was
surgery.
going. Yeah, that's where I was going. So like we know it happens all in those acute things and severe side, but in the world of outpatient acute issues, acute muscular strains, acute surgeries, acute injuries, you can see significant benefit, somewhere between 20 to 70% faster recoveries in those kinds of situations. And it's a big range because it depends on the person and kind of their ecosystem before they get the injury, of course. But the range, I've worked with many athletes over the years, getting them back 50% faster, 50% faster is very, very common. So I think for acute injuries, hyperbaric therapy is a fantastic tool because it can decrease inflammation, it can decrease swelling, it can get stem cells going, it reverses low oxygen states, it kills bugs, it optimizes your immune system. Okay. Now, when it comes to like long-term or more chronic issues, where I've seen the most, I've seen benefit across the board in so many different things, but I've seen a lot of great benefits for brain-related things, especially concussion, post-concussive syndrome. So people have long-term concussion symptoms, they can do very, very well using hyperbaric therapy. But in the chronic bucket of things, it really does take a more foundational approach, a more holistic approach. You can't just put somebody in chamber and see benefit. Oftentimes, you have to be thinking about some of the stuff we were talking about before, how well they can make energy, how well they can detox, what other modalities will be helpful. Do they need neurofeedback? Do they need, whatever it might be? Like you need to have usually a more comprehensive approach. And I've gotten in trouble with my colleagues in the hyperbaric community because I often will say, don't put people in the chamber. Just don't put people in the chamber until they're ready. Even if you have a hyperbaric facility, that's difficult to do. But the reason for that is I often find that if you can get them foundationally more optimized, they do better, much better over the long term.
Yeah.
And so,
a perfect example of that is I had a diabetic patient that had done a little research on his own, and he came back and said, hey, I think I really want to do some hyperbaric treatments. And I'm like, oh, that would be amazing. But I've been begging you to get your A1C down and dial in your diet. And I said, I'm not sure you're going to reap the benefits from hyperbaric that you want with an A1C in the 9. So you guys got to start pulling this down. And that goes to your statement. Don't just put people in the chamber, work on those foundational pieces. And then hyperbaric really can provide kind of this amazing neuroscience, anti-inflammatory, calming, oxidative benefit. So
yeah, and just to add on to that, I have unfortunately had the experience of being in this field for 10 years, for a decade. And I got burned a lot of times in the beginning because I wasn't taught that this was something that I should do. I should wait to put people in the chamber and make sure they're foundationally more optimized before going in. And so I'd see people not get better at all, sometimes get really bad or get worse in the chamber. And then they would get slightly better and we're like, oh, maybe this is better. And we keep going. And then they kind of get better. And then they finish the hyperbaric protocol and then they start feeling about the same that they did before. And 2, 3, 4, 5, some months later, not that long later kind of thing. So my big thing always is it's not if hyperbaric therapy can be helpful, it's when it's going to be most appropriate. And I've seen amazing recoveries in people like many years post things, even sometimes like post concussion, post stroke, patients with mild cognitive impairment, either early stages of Alzheimer's disease or Parkinson's, or people with Lyme disease that were really debilitated, do very, very well adding hyperbaric therapy to the mix. But the key almost across the board is doing foundational work with these people first. And that's kind of how I developed an interest in learning what my foundation was going to be. And I wasn't aligned with functional medicine directly because I didn't feel as aligned with the sort of root cause perspective, although I have a lot of friends that do this work and I'm very appreciative of what they do. So my focus is more on that foundational chemistry, that foundational biochemistry. Can they make energy appropriately? Can they detox appropriately? Do they have optimized vitamins, minerals, and nutrients for the cellular processes that are really the most foundation?
So you're using that approach as it's even different from the current modem of functional medicine, right?
It absolutely
it's
is.
Metabolic medicine, if you will. You're separating yourself from that fray.
Yeah. Again, I have a lot of good friends that are functional docs, but I think what can sometimes be lost is focusing on the foundational basic, in quotes, things, as opposed to going for the line or going for the mold or going for the heavy metal. Instead of doing the foundational stuff and working on that, at least at the same time, it just sometimes I feel like people are just going down those rabbit holes too fast. And so I like to foundationally work on people. I will absolutely refer to my friends and colleagues that do really great work with mold and lime and things. But, oftentimes this is hard for people to hear sometimes, like it's not the mold or the lime that's the issue. It's the immune system that's the issue and the guts that's the issue. And if you can address those things, oftentimes you don't have to do as much to address the lime or the mold itself. And in fact, most of us, if like you grew up in New York, like I did, like been exposed to Lyme at some point. If you lived in any place,
and they're always exposed to mold. I don't know who isn't. It's ubiquitous. Exactly. It's at every old building or probably every home. So I totally agree. I have attended a couple of the SIRSX conferences and appreciate the science that's being promulgated and brought forth. One of the complexities is that many of the biomarkers, complement C4A and C3A and MMP9 and TGF-beta, they're kind of utilized as these definitive markers of mold, and really they're just definitive cytokines. We know there's an inflammatory response systemic that's occurring, and that might be occurring because they have Lyme at the same time they have mold, or they might be occurring because they have Epstein-Barr, or they had a history of Guillain-Barré or whatever. So we're on the same page. I really appreciate that perspective. Going back to hyperbaric, there is a spectrum of interventions. Shia Fradi, out of, I know you're familiar with that, talks about a lot of these interventions that really are reflecting pressures of 2.0 or in that neighborhood. And then there's another perspective. Paul Harch has done a lot of research looking at low pressure, even sometimes using a home-based machines. And those two, I don't know that they've ever argued face-to-face, but they don't promote the exact same model. And so I'm curious, where do you sit in this spectrum of high pressure versus low pressure, and even specifically when it comes to neurological issues like brain fog or post-concussive syndrome or post-stroke? Do you float somewhere closer to one or the other in terms of pressures?
Yeah. So obviously Paul has been doing this a long time, Dr. Paul Harch, and I really respect a lot of the work that he's done over the years, especially in the milder pressure scenarios. And Shia's work is fantastic. He's done a lot of great studies, and he's got a great facility there in Asaf Harofeh Hospital in Tel Aviv, and they have a facility in Florida as well. They're building these commercial facilities around the world. And so I do appreciate both of them, but I think they're both right, but I think they're both wrong. And I think that the challenge is that people are very different when it comes to it. So somebody that's 85 years old and has Alzheimer's, and you want to put in a chamber, versus somebody that is 55 years old and has Alzheimer's. So it's a very different brain.
Totally.
And so if you're looking at it in that perspective, what I'm always thinking about in these patients is what I was describing before. How is their foundational health? And then taking it from there as much as I can, knowing that, and I do agree with Paul that I do think that brain injury, neurologic pressures are milder in general. However, some people will not respond at those milder pressures. And so what I'll often do is I talk about dynamic hyperbaric protocols and responsive hyperbaric protocols. It's not like a one size fits all. And that's not something you can get done by Shia, for sure. You're getting the same pressure, the same treatment, same protocol almost every single time.
Which is really how studies are run. You can't run a study with this modified dynamic dosing.
Yeah, and then this is the thing. For me, it's like over the years, I've really created an integrative perspective where I think of diet, lifestyle, supplements, practitioners, practices, hyperbaric therapy, and then you bring all that together, and then you create a hyperbaric protocol, and then you have to follow people over time and be dynamic about it, because we don't have a lot of good ways to really assess objectively blood flow in the chamber. And it would be nice that we have a couple that are not great, but there are some that are coming that can assess, like, this is going to be the perfect pressure for your brain. This is going to be the perfect pressure for your body or your toe or whatever. We just don't have that kind of granularity yet. I think that'll come. But so for now, I typically will usually start milder for most people, and then I will go deeper if I need to, depending on their progress. Or if they're really sick, oftentimes you don't want to start off at a very deep pressure because it can cause a lot of detoxification kinds of symptoms, and you want to start off milder. So for me, I kind of fall in somewhere in between. I respect them both a lot, but I am very dynamic in the way I think about it, because in my experience, one size does not fit all. And I've seen in both cases where they've gotten better using Paul's or using Shy's protocols, but then they go back to the way they were before in 6 months. And I'm like, well, how helpful was that? Because, Shy and Paul have very little emphasis on anything else but hyperbaric therapy.
Yeah, that's a true statement.
Yeah, what they're great at is diagnostics. They have a number of diagnostics you do before you start your protocol, and then diagnostics afterwards to show you what got better. But very little interventions otherwise, and maybe like a couple of community meetings about diet or something. I even asked Shy about this when I was in Israel in 2018. It's like, and it's a good reason. Like, we can't do anything if we're running studies. We can't have any other direct interventions.
You can't change all the, otherwise it messes up the study. So
yeah. And then Paul's has very little emphasis on diet overall, as far as I'm aware. He may have changed it over the last couple of years, but I found that without a comprehensive framework, people just end up going back to the way they were, or not having as significant a benefit over the long term as they could.
Yeah, I love it. Okay, I want to shift into another topic. Mark Gordon runs TBI Help Now, and he talks a lot about hormone replacement therapy or optimization in the context of brain health, which is awesome. I've been through his course and I really enjoyed it. The flip side to that is there's hormone pellet clinics popping up all over the country that will just jack up a woman's testosterone or a guy's testosterone at these crazy numbers. I'm not a fan of that. I think it actually creates a problem. There's a dynamic balance that is sought. So would you speak to your thoughts and your experience when it comes to hormone optimization in that context, recognizing there's pellet clinics that kind of just do estradiol and testosterone, and they're actually really high dosing. I'm speaking generally because there's some that are not, and sure. Then there's Mark Gordon, who says, man, you've got to look at pregnenolone and DHEA, and you're looking at your luteinizing hormones, and you're taking all that into account. Do you have a thought or a statement about that?
Yeah, I mean, I think you probably know where I stand on this, but it's the hormones really need to be repleted and optimized in a network, because every hormone has a feedback mechanism that's going to affect other hormone networks. So you absolutely do not want to get into a place where you're just looking at two hormones and then just disregarding the rest. And Mark Gordon's one of the originals, the OGs, when it comes to hormone balancing. I respect and appreciate his work very much, especially when it comes to brain injury. Although he would even tell you now that he does much less in the hormone world than he used to. He does a lot of work on neuroinflammation, and he has supplementation that he works on for people now instead of going directly to hormones. But hormones will be the fastest in some of these people to get them better. That is for sure. So in my perspective, which is a little bit different than Mark's, but pretty close, is we like to optimize people's hormones between 21 and 30 years of age. And that's when your hormones are optimal for everything you can imagine in life that you want to do. You remember being between 21 and 30 years of age, being able to go to sleep when you want to, eat what you want, kind of, and then feel fine. You can have like a whole bucket of ice cream and go to bed, and you feel in the morning, you feel you're good, but it doesn't happen when you're 45, that kind of thing. So when you're that age, you have optimized levels of hormones usually, although that's not always the case anymore because of how toxic the world is. But so my goal with the people that I work with on hormone optimization is to get them through to those levels, but for all of the hormones, all the hormones that we can measure. So all of your pituitary hormones, all of your thyroid hormone, your adrenal hormones, your gonads, your genital hormones. So you're talking about all of those together, and because knowing that these have effect on each other. So if you're doing something with just testosterone, you can mess up other things. If you're doing just thyroid as well, you can mess things up too. So it's a matter of doing the full spectrum in my practice. Yeah.
Yeah. And I think I know how you would respond to this question, but I want to ask it anyway. It's not uncommon in our age that a 30 or a 35-year-old has low T, and they can have low T in part because they're overweight and they aromatize a fair amount of that to estrogen. It can be low T because Mark Gordon says they had a head injury, and so therefore it's a secondary problem because the pituitary glands are bad. It might be low T just because sheer lifestyle or xenoestrogens and so forth. So there's always this argument about, we put a 35-year-old male on testosterone, which would then have a negative feedback loop through the pituitary, or would we use clomiphene or N-clomiphene or something like that? How do you approach the young man, not young being the 30-year-old where there clearly is a hormone problem, and now you're trying to balance, do I use a SERM or do I use actually testosterone? What any clinical pearls that you would add to that?
Well, I mean, I think you were kind of going the direction where I would go is I'd be very much trying to keep this person off of anything exogenous as possible by looking at their diet, looking at their lifestyle, looking at their water intake, like you said, looking at their relationships and trying to work on all of that as much as possible, looking at their exercise routines and see what we can do about increasing their testosterone production naturally. That would definitely be my first, second, and third step there. If that wasn't successful, like for example, if it is somebody with like a brain injury that does have a pituitary deficiency, they're not going to be making testosterone no matter what you do. Then it's a really good question, because if you're putting them on testosterone, you're basically relegating them to testosterone for their almost for the rest of their life. It's very difficult. Sure. There are ways you can do that. The way that we do it at Health Optimization Medicine is we typically have people that we can take a break from testosterone every 3 months and give them GnRH so that it reboots their system to make testosterone in their hypothalamus and pituitary. You could do that. They feel terrible that month, but at least it reboots their own LH drive, and so they can make testosterone. But Mark's perspective is usually clomiphene for these patients. Mm-hmm. It can be given very sporadically. I know that there's downsides, unfortunately, to clomiphene. People can, with that, I've had multiple people say they don't feel very good on it. They feel, and I think it depends on the person overall. But usually the next step would be clomiphene for these patients if they tolerate it. At least that's producing their own testosterone that way and not, exogenous. And then, from there would be testosterone. That would probably be my mode of operation. But I mean, nutrient optimization, gut healing, dietary, exercise, weight loss, leaving their job, whatever it might be. Like oftentimes a lot of things can boost testosterone without having to get on meds right away.
Okay, my next question, it might be personal, and you can say, hey, I don't want to talk about that. But
okay.
I wanted to ask you, I think that you had a snowboarding injury earlier this year where you hit your own head and may have had some mild post-concussive symptoms.
Yeah.
If I visit with you or interview you, I'm assuming here's a guy who does the lifestyle things. He teaches it so he understands it. And then you yourself had a mild head injury. What did you do different, or what was your focus during that time to aid in your own personal recovery?
Yeah, it's happened to me a couple of times. I had a mild concussion maybe 4 or 5 years ago, a very stupid concussion, like hitting the side of a bathroom wall or something, when somebody screamed as I was urinating and I hit my head. And so that one was less obvious that I had a concussion. The one that I had a couple months ago, snowboarding with my daughter, was very obvious. I mean, I flipped over, and when I landed on my head, when I stopped and I could not say my daughter's name. I said everybody else's name that I could think of, but I couldn't say her name.
Wow.
It took me about 2 minutes to be able to come back and actually think. And it's like, wow, I definitely got my bell rung, as we would say.
Sure.
And so what I'm thinking about here is like, okay, number one, did I have a concussion? The answer is yes, I did have one. So and then the second question is, do I need to go see somebody, or is this going to be something I can manage my own? So, and it was mild enough where I felt that I was going to be okay. And so I just did everything that I knew how to do, which is, I have a chamber at my house. So I got in my chamber twice a day. I was, making sure that I was eating cleaner than I would typically. I eat clean already, but eating very clean. I had my methylene blue going. I was having my methylene blue to make sure that I was supporting energy production and detox. I was hydrating well, and I was getting myself sleep. But I got myself better in 2 days. I was back to normal, and this has happened to me before. And it's nice. I'm very lucky to have a chamber in my house that I can use, but there's a lot of facilities around these days where you can get this kind of care if you need it. And I love it that I have it for my kids too, because they play sports, and I know that if they get hit, if they get, a little beat up, I can get them in a chamber and do it. But yeah, it was a combination of multiple different supplements. I mean, certainly increasing my fish oil, increasing my B vitamins. I was already on probiotics, so I kind of kept that the same. I'm trying to think what else I did. Yeah, and then hyperbaric therapy and methylene blue.
When you increased your fish oil, what did you go to?
Yeah, I usually just have about 1 to 2 grams a day, typically, and I went up to 4 grams a day. I mean, there are some protocols that put it up to like 20 grams a day, in fact, but I didn't. I know the research. I know the guy that did the book, but I didn't feel strongly that's what I needed, and so I went up to a little bit. Methylene blue was a big one. I went to a pretty high dose overall to support the mitochondria. And then we have another supplement that came out right at the time I was actually, funny enough, I was testing it. It was something called Tromune, which is high strength extract of the cordyceps mushroom called cordycepin is the ingredient. And it's a neuromodulator for immune system function, inflammation, decreases inflammation. It's an adenosine agonist, so it improves deep sleep at the same time. And I slept like a baby using it, which was great. And I felt so much better I did, I can't put anything in isolation because I felt.
Yeah, because it was a program. It wasn't
Right.
just one intervention, but you kind of ramped up some of the things that you were doing. And, I'm assuming you don't get in a hyperbaric twice a day typically, but
No, not typically. No.
do that
Yeah.
model at home.
Yeah, I had some neck stuff going on too. So I have, I was doing like a lot of sauna. Like I have a infrared sauna at my house. And so I typically use that most nights, but I was in there for much longer in there too, and doing more light stretching and, not obviously exercising super heavy, but not, there used to be this advice to sit in a dark room until you feel better, but that's like the worst advice ever. And that doctors still give, unfortunately, for concussions. But the idea is to come back to activity as, slowly, but, not deprive yourself of getting out there and moving, because it is good for blood flow to the brain to.
Oh my gosh, yeah. The University of Pittsburgh Medical Center, Nikki Collins and Anthony Contos, they talk about what terrible advice it has been for 50 years to lay in a dark room and wait till your symptoms resolve. There's no other intervention in the world. We have people that have back surgery or total hip surgery, and they're walking 2 hours later. They're active. Everything is in active protocol. So in the concussion protocols that's actually the worst advice. In fact, I think I'll probably get it wrong, but there was the Buffalo concussion treadmill trial where they took individuals who had concussions and they instantly put them on a treadmill and did the stress test. And the cardiologist came up with this, but he segued into cognitive health. But the whole point was people did so much better and recovered so much quicker when you exercise them at a sub-threshold. So just like with heart disease, you push them until they get cardiac symptoms and then you back off. And he developed some rhythms where you push people until they get vertigo or they get other neurological symptoms, brain fog, and then you exercise them at 10% sub-threshold. That research is totally awesome. So it's not the status quo though.
And it makes so much sense, because what are you doing? So when you get an injury to your brain, it's very difficult for your brain to heal because it can't harness the mechanisms that it could if you had a knee injury where it can swell up to a baseball size. If your brain swells up to a baseball size, you die because it herniates. And so it has to have a governor on those types of mechanisms. So you need to get more oxygen to that tissue to make it heal. And so how can you do that? You can go for a walk and do that kind of treadmill kind of thing, which is great. Or you can go into a hyperbaric chamber because you get an increased amount of oxygen in circulation. Or you can take methylene blue, which is going to help you make energy or get more ability of those cells to make energy, even if there's not as much oxygen around. So yeah, I'm 100% with you that the concussion evidence or the concussion guidance that has been given is just terrible. And unfortunately, most of these concussion clinics at most of these universities are terrible. They give you some physical therapy, some occupational therapy, but like that's it. And then you're on your way to coming to see me in 6 months with symptoms still, unfortunately.
Exactly. And years ago, I did some consulting for an assisted living center, and I helped them put on an exercise with oxygen. So, you've seen the EWAT devices, LiveO2 is what we used. And it was really fascinating for me to see. We use a CPAP device to help people improve their oxygenation at night, but many of these seniors have such terrible fatigue and bad exercise recovery. It was really fascinating to put them on an EWAT device, and they'd say, well, I can't do very much because my knee hurts or I can't recover. And this actually gave them an opportunity to be physically active without all of the pain after the fact. It was pretty amazing, actually.
I've seen some great reports and great overall outcomes using EWAT, especially in people with injuries, which you'd be surprised about because they can't do very much. But even just getting a little more oxygen to the tissue that you're working can go massively in a beneficial direction. And this is where I often recommend people that are in a hyperbaric chamber, if it's possible, bring something in there that's going to work the type of area that you need it. So if it's your knee, if it's your back, bring something in there, even if it's like a foam roller, like a ball or something, that if you have a home chamber like I do, that's very easy to do. So.
Yeah. Okay, one last question, because I know we're kind of getting out of time. And this is not a simple question. You might just say, hey, I'm going to give you bare bones, and then we got to wrap up.
Okay.
Isn't it fascinating how much autoimmunity is going on in society today, right? I mean, autoimmunity is the fastest growing category of diseases, chronic diseases that we know of. And so when you're visiting with a client that looks like two scenarios, you think they probably have autoimmunity, but there's never been a diagnostic approach to that, or people who clearly are on disease modifying medications. Walk us through how do you view that? How do you start your process of working through that?
Yeah, it's a good question. And there's a lot of facets to it. I know you're absolutely right that autoimmunity is just going up, rampant levels across mostly the developed world. You don't see autoimmunity as much in non-developed countries, in more, quote unquote, third world countries, where there's a lot of more infection, there's a lot more exposures, tends to be autoimmunity higher in cleaner societies where there's more hygiene. And we see a huge raft of this. We're going to see much more of this post-COVID as well, especially in kids that weren't subject to any viral infections at all because they were kept in their houses for 3 years without any exposures. I mean, I remember I was talking to parents during the beginning, maybe about a year into the pandemic, and they're like, "Oh, it's so great. My kids haven't been sick in a year. It's like so amazing." I'm like, "No, that's not a good thing. It's a bad thing.
Exactly.
It's a bad thing. Your kids need to get sick or else they're going to get autoimmunity. Your immune system needs these exposures to keep it healthy, just like you need to keep exercising to maintain your muscle mass. It's the same kind of deal." And so when I find somebody or I talk to somebody that has autoimmune condition or something we think it's an autoimmune condition, what we try to do here is try to break down the history of things, understanding what exposure they might have had, understanding how this may have developed and why. That's the first question. That's the clinical part. That's really, really important. Then really it's going to go down or come down to me is like, what are the foundational things we need to do to help this person work on their immune system, but work on it like we're using the gut, you work on it using cellular optimization, energy production, antioxidant, the same kinds of things, because it all matters. Now, it doesn't take, I don't think really anything takes the place of that. So once you can kind of get a foundational program together for people, oftentimes a lot of their symptoms are going to get better. However, on the other side of things, oftentimes people are going to need additional things, maybe need advanced infectious testing or advanced, neurologic neurotransmitter, whatever. But there can be so many different things that you can do. But I think focusing on that foundation is really important. And then I have used hyperbaric therapy over the years to help these patients. It can be very, very helpful, but it's usually not a cure for them. It's usually something that can mitigate symptoms, which can be really, really helpful. I mean, I've had people with rheumatoid arthritis and lupus and really, really bad, autoimmune types of presentations, even like a chronic fatigue syndrome or fibromyalgia, which oftentimes are autoimmune related, even if they're spurred on by an infection initially, or, maybe a vaccination, which also can help, which also can happen. So, but in the end, hyperbaric therapy is not going to be a cure for most of these people. It can be something that can help chronically manage their symptoms, which can be really helpful for some people. But of course, the goal is to try to reverse this stuff and make it go away to as significant degrees that we can. And so, yeah, my approach is that it's foundation first, then it's looking at other modalities, other practitioners that might be able to help. And then
Dr. Scott, I love our conversation. I've learned something about you today. I've listened and watched most of your podcasts, but I learned something today that your perspective of differentiating the kind of this conventional functional medicine approach is very different than looking at the foundational metabolomic component that you talked about. I agree with you. And when I visit with someone, let's say that I have a client that comes in that has ADD, or they are on medicines for depression, and they say, "Hey, can you refill my medicines?" I've often said, "Look, I'm not a medication racist, if you will. I'm going to refill your medicines on one condition, that you'll start working with me to figure out, why are you suffering from this symptom in the first place? What is it about your life experience or your exposures or your history of infections or your lifestyle or whatever that's contributory to the fact that you feel like you can't stay focused?" And then as we work through those things together, the medicine gives us the short-term gain and the confidence that we can address it today while we're trying to minimize the deterioration of this over time, maybe even reverse it and make it better.
Some people are not ready to do the lifestyle stuff first. And then one way in there is to go through the data and the laboratory collection and show them what's going on. It really depends on the person. But in essence, what we're hoping to do is give people long-term benefits with what we do. And the short-term fixes will often not do that, unfortunately, but they can help keep things like slightly more compensated. And then you can use things along the way on the short term to help people long term as well. And that's what, some of the supplements and things that, that I use can do, like methylene blue, for example.
Awesome. Hey, Dr. Scott, will you tell people where they can find you? I want to introduce you to my community. And so tell people
Sure.
where to find you if they're interested in more info or a consult.
Sure. So I have two hyperbaric places you can go. I have a company called One Base Health. That company is creating an ecosystem, including hyperbaric chambers for personal and for professional use, looking at how you integrate those other technologies in your clinical practice or at home, and various types of protocols that you can use. My personal consulting is at integrativehbot.com. The word integrative and the letters hbot.com. That's where you can find me if you're interested in learning more about, and speaking to me about, particular issues and helping consult with you to find, the best protocols and the best places to go around the country. And then I have my product development company called Transcriptions. We make these things called buccal troches that are there to help you initially when you're on that path to optimizing your health. Ones with methylene blue called Just Blue and Blue Cannatine, which is a combination of things, along with our GABA system ones, Trocom and Trozy. And Tromium is the one for immune system function and sleep that helps with deep sleep specifically. And then finally, we have our nonprofit called Health Optimization Medicine and Practice. And this is homehope.org. And this is our practitioner training. It's for doctors and non-doctors that are interested in learning how to optimize the health of their patients using a 7-module certification course, with the primary module being metabolomics.
And is that certification course online, or is that a live seminar
It's
series
online.
that you come to?
Yeah, it's online certification. And we all usually have a yearly conference as well, where we invite everybody to come and listen to speakers. I think our next one's going to be just before A4M this December in Las Vegas.
Love it. Cool. All right. Well, Dr. Scott, thanks so much for your willingness to participate today and share your knowledge. Much appreciated.
My pleasure, Randy. Nice to see you.